What's up, beautiful people? Another day, another study. It is no secret that I'm a big fan of fiber, and also I'm a big fan of multimodal treatment modalities. That's when we combine more than one thing. That's what happens every day in medicine all across the country. So I love seeing trials that involve fiber and trials that involving combining interventions. And that's what this trial did. So they looked at inulin fiber. Inulin fiber often comes from chicory root, but also from things like artichokes. And inulin fiber has been associated with improvements in metabolic health, so body composition, blood sugar control, also inflammatory markers in people with obesity and people with diabetes. And they're looking at knee arthritis. So that's a common reason why people come in, very common condition we treat in primary care. We know that physiotherapy, exercise are mainstays of treatment. We have tons of data, meta-analytic data showing improvement in outcomes through exercise. Now, recent evidence shows that the gut microbiome plays a role in systemic inflammation, but also pain sensitivity and pain perception. And it's thought that gut microbiome products like short chain fatty acids, these are things that are derived from fiber that gut bacteria make from fiber. So the gut bacteria take them in and they spit out these short chain fatty acids like butyrate, like acetate, like propionate. Those are short chain fatty acids. Inulin, we just mentioned, prebiotic fiber. And this study looked at adding inulin to 6 weeks of digital physiotherapy, which I love. I love seeing studies with digital interventions because it is a one-to-many type approach. And I've invested in digital health companies. I've been a part of digital health companies. I think that is a way for the future of getting people access to these, especially in communities where you may not have someone trained in this. So participants were randomized to 4 groups. They had the exercise group, the inulin group, the exercise and inulin group, or placebo and usual care. The dose of inulin was 20 grams in powdered form, which is in line with what most studies will do, usually between 10 and 50 milligrams. Above 15 is where you start to see some GI intolerance. Adherence was high to both groups, over 80%. Again, the number one adverse effect we saw in the inulin group were GI events. 23 out of 50 participants had like bloating and gas, but there were no serious adverse events. And these tend to go away as people get used to metabolizing the inulin fiber. Now, they looked at something called NRS pain scores, and both the exercise group and inulin group saw improvements in pain scores with moderate to large effect sizes. And the MCID, or minimal clinically important difference, was 1, so both met that threshold. Now, the combination group had a stronger effect. The power analysis indicated the study was underpowered to detect the difference, so take that with a grain of salt. Secondary outcomes were exploratory, again, because of the size of the trial. There were improvements in pain sensitivity, proximal and central pain sensitization, and that only occurred in the inulin groups. The inulin groups also saw improvements in butyric acid, which is a short-chain fatty acid. There was also an increase in GLP-1 levels, but when they looked at the short-chain fatty acid levels and pain levels, there was not an association between the levels. And then unsurprisingly, we saw improvements in squatting and walking ability in the exercise groups. An interesting exploratory finding was that there was an increase in grip strength in the inulin group, which has also been seen in another study using inulin, a similar study. So that's a really interesting effect. It's pointing to like a gut muscle connection, or maybe a gut muscle nerve connection. Either way, in another exploratory analysis, the increase in grip strength was associated with an increase in GLP-1 levels. Again, exploratory, I thought it's interesting. Don't draw any hard conclusions from that. Overall, I think this was an interesting study. Like most of the studies in this area, it was small. There were some issues with the study design and recruitment and all of that. However, I think inulin is relatively cheap, is safe as far as adverse effects go. So it's something you could try if you have knee pain, knee arthritis, and you want to see if it improves your pain.